Welcome to CEREBRAL Tutorials. If this is your first time here, we offer bite-sized revision videos on various pathology topics affecting each of the organ systems. We hope you'll find our videos fun and informative. Hit that like button, comment, and don't forget to subscribe. Now let's get revising. Cerebral aneurysms. What is it? These are abnormal widenings or dilatations of blood vessels within the brain. Etiology. Most cerebral aneurysms occur at the weak points at artery joints, such as at bifurcations or branches, and the most commonly affected artery is the anterior cerebral artery. Most cerebral aneurysms are secondary to another disease process. For example, most occur in patients with pre-existing hypertension, atherosclerosis, alcoholism, or trauma, and tend to occur in patients aged 40 to 60. Some congenital conditions, such as Marfan's or Ehlers-Danlos, also increases the risk of developing aneurysms. They can be classified as saccular, also known as berry, which is a dilatation only on one side of the vessel, or fusiform, which is a circumferential dilatation of the vessel. Symptoms. Most cerebral aneurysms are asymptomatic until complications have developed. The most important complication of cerebral aneurysms is subarachnoid hemorrhage. This is where the aneurysm ruptures and bleeds into the subarachnoid space between the arachnoid membrane and the pia mater of the meninges. When this occurs, the patient will experience symptoms of severe headaches, described as the worst headache of the patient's life, or as a thunderclap. Facial and neck pain with stiffness can also be present, alongside syncope, seizures, and visual disturbances such as blurry vision, diplopia, and visual field defects. Diagnosis. The best diagnostic test for identifying cerebral aneurysms is a CT/MRI scan. This helps to identify the location of the ruptured vessel and the location of the bleed. Lumbar puncture can also be used to identify the presence of blood in the cerebral spinal fluid, which can indicate a bleed within the central nervous system. It also helps to differentiate between subarachnoid hemorrhage and meningitis. Angiography should also be adopted prior to intervention. This is to plan the best course of management for the patient. Treatment. A ruptured aneurysm is an uncommon cause of stroke, and if a patient is suspected of having a subarachnoid hemorrhage, it must be treated as a medical emergency. The treatment administered depends on the degree of blood loss and also on the patient's symptoms. This assessment is made based on the Hunt-Hess scale, with 1 being mild symptoms and 5 being the most severe. Medical intervention involves clipping the ruptured aneurysm or endovascular coiling and is best used for fusiform aneurysms, which are the ones most likely to rupture. During clipping, a portion of the skull directly overlying the ruptured aneurysm is opened and a metal clip is placed around the dilation. Glucocorticoids may also be administered to reduce the neck and head pain caused by the subarachnoid blood. It may also help to reduce edema and provide neuroprotection. However, glucocorticoids are not routinely used. I hope you enjoyed this bite-sized revision video on cerebral aneurysms. Feel free to leave a comment, like and subscribe if you'd like to see more videos like these. Also, head over to my Quizlet link in the description for free revision flashcards. Happy revising!